Hello, everyone, and thank you for attending today's webinar. Before we begin, we would like to cover a few housekeeping items. At the bottom of your audience console are multiple application widgets you can use. You can expand each widget by clicking on the maximize icon at the top right of the widget or dragging the bottom right of the widget panel. If you have any questions during the webcast, you can click on the purple Q&A widget at the bottom to submit your question. You can submit questions anytime through the webinar. You don't have to go to the Q&A session. Please note, we have enabled the group chat option for this event, meaning attendees can speak to other attendees and also speak with the panelists as well. If you have any technical difficulties, please click on the yellow help widget. It's a question mark icon that covers comments and issues. You can also submit technical issues via the Q&A widget. Please note, most technical issues can be resolved by pressing F5 or Command-R on Macs to refresh your player console. Finally, an on-demand of this webcast will be available one day after the webcast using the same audience link to join today's event. Now I'd like to introduce Alisha Gillis. Alisha, you now have the floor.
Thank you. Hello, and thank you all for joining us for this Mathematica and Route 50 co-hosted event titled Govern with Confidence, Tools for High-Stakes Decision-Making During COVID-19. My name is Alisha Gillis, and I am the Senior Editor of Route 50, a digital news publication from Government Executive Media Group, Inc., that connects the people and ideas advancing state, county, and municipal government across the United States. And just by way of background, prior to joining Route 50, I spent the majority of my career working with state and local associations, most notably with the National Governors Association. Interestingly enough, it's my former position at NGA that is partly the reason that we are all here today. In full disclosure, my former NGA colleague, Carmen Farrow, who's now with Mathematica, reached out to me in midsummer interested in co-hosting an event focused on helping state and local leaders make effectively sound and strong decisions in times of crisis by leveraging data and identifying cross-sector solutions. Needless to say, when this idea came to me, I jumped at the opportunity. The COVID-19 pandemic has definitely been a significant test for all state and local leaders. It's highlighted the interconnectedness of issue areas, and its dynamic nature has definitely challenged state and local leaders to make incredibly consequential decisions at times with sometimes limited certainty. Over the course of the next hour and a half, we will explore how state and local leaders now and in the future can work smarter, faster, and more efficiently in high-impact situations. And we'll get at this by focusing on synergies among three main topics: workforce planning, public health equity, and education readiness. Today's conversation will be broken down into three parts in which all of our panelists will have an opportunity to contribute. We'll aim to take audience questions periodically throughout the afternoon with some added emphasis on questions at the end. As a reminder, you can submit questions throughout the event using the Q&A widget. We will try to get to as many of your questions as possible, but we'll follow up with those we don't get to. Also, please be sure to check out additional resources in the resources widget. Though we cannot solve everything today, we hope this conversation will shed light on some tools and strategies for state and local leaders who are at the forefront of real-time, high-stakes decision-making, knowing that these decisions are impacting families, businesses, and communities. Now, I'd like to introduce our panelists. In the interest of time, I won't give everyone's bios, but you can learn more about our esteemed panelists on the event webpage. So, joining me today are Jill Constantine, Senior Vice President, Mathematica, and audience, please make sure to wish Jill a very happy birthday. We are also joined by Jed Herman, Vice President, Results for America, Oscar Elaine, Chief of Programs and Services, National Association of County and City Health Officials, Joshua Franzel, President and CEO, Center for State and Local Government Excellence, Catherine Patterson, Co-Executive Director, City Health, and Megan McCann, Senior Policy Analyst, Education Commission of the States. Thank all of you for joining me today. I'm really excited to have this conversation. So with that, let's go right into it. So as I alluded to at the top of my remarks, obviously we are in a high stakes, high impact, and incredibly dynamic event right now. And to me, being adaptable is key to managing the times that we find ourselves in. So to kind of set us up and to kind of to just think broader and to think a little bit outside of the box, I'd like to do a quick thought exercise, and it'll require you to pretend a little bit. But one thing I do want to kind of, in this thought exercise frame, is this, to help us think about adaptability. What if we lived in a world where COVID-19, there was no possibility for a vaccine? And instead, this was going to be our permanent new normal. In that instance, instead of biding our time in some ways, which it feels like we're just kind of waiting to get to that vaccine and we're just kind of trying to do the best that we can, how can we adapt and how can state and local leaders identify solutions that can help permanently adapt to this situation? What does that mean for education in this country? What does it mean for workforce planning? What does that mean for the public health sector? And how do we think about these changes in an interconnected fashion? So I'm going to start in reverse order. Again, I know this is a big topic and a little bit of a kind of out of the box thought exercise, but I'm going to start with Megan and ask her to kind of give us her thoughts on, in this world of a non-vaccine, how do state and local leaders adapt? So Megan, go ahead.
Thank you so much, Alisha, and I'm so thrilled to be here to talk with about education policy with my public health and my workforce colleagues. You know, I think one important piece to note here and how we're going to adapt is to talk about how interconnected all of these issues are to get us started. Public health and education are inextricably linked. Health and wellness are indicators of educational success, and education is considered a social determinant of health. So when we start talking about how do we adapt to an environment without the potential of a vaccine, I think it's really important that we call that out. In addition, the P20W education spectrum, as we refer to it often, and the transitions throughout that really tie education and the workforce together in how we think about things. So I'm excited to be here because I think having these conversations together is really critical. You know, with or without a vaccine, I think COVID-19 has already impacted nearly every aspect of the education system. So even if we're looking forward without a vaccine, the education system has really been impacted in a lot of ways and will move forward similarly, from early childhood education and kindergarten entry to workforce readiness and everything in between. And I think there are real questions here and information gaps that we can be looking at that'll be critical to fill with reliable data as we move forward. Everything from how the COVID slide will impact learning loss, the toll the pandemic and racial injustice has taken on student and teacher mental health and wellness, how schools will assess students in remote or hybrid learning settings, and what those assessments may mean for school improvement and accountability moving forward. Not to mention how the gap in data that we have from the waived assessments and accountability this past spring will factor in long term. And while these may seem like potentially insurmountable obstacles, I think they present real opportunities for state innovation that I'm excited and looking forward to discussing later on today.
Excellent, Megan. Thank you so much. Catherine, I'm going to ask you the same question.
Oh, I feel so lucky to have gone after Megan. So I work for an organization that has identified 9 specific policies that are attempting to help all city residents thrive. And those 9 policies cover everything from affordable housing to access to safe and healthy food, to access to things like earned sick leave, which take on a new resonance during a pandemic. And also look at things like high quality education. So Megan's point is absolutely spot on. All of these things are interconnected. What I think is fascinating is that when we look at returning to the new normal, I'm not really sure if going back is the best answer. I think we need to continue to look at innovative local policy solutions that we know have an evidence base, that we know have a return for the public and can help all residents in a community thrive. When I think about what we can do in the interim and how we use our time and our energy right now, it's really fascinating to look and see at what cities in particular are doing, especially when they're looking at, reductions in revenue, looking at ways to be smart and creative and allow people to continue to do things like get outside when they don't have access to things like gym memberships or public pools. So again, I just think it's incredibly important that we continue to focus on all aspects of the environment. We want to make sure that people can make, the healthy choice is the default choice. And that seems to be the name of the game, no matter when the vaccine becomes available.
Thanks, Catherine. I'm now going to ask Joshua to weigh in.
Yeah, so I guess I'd answer the question from both a tactical and more strategic perspective. From more of a direct tactical perspective, as you're seeing with events like this, governments states and localities are beginning to really embrace virtual communications for both their recruitment efforts, for their onboarding efforts, and for their retention efforts to ensure that there continues to be a harmonized workforce as there would be at a city hall or administrative building. And we're seeing that across a range of states and localities in terms of, really embracing some of these technologies. And then at the same time, as we all know, for our research, when we've asked about the impacts of sort of the COVID-19 environment on the workforce, we're seeing about 80% of state and local workers in our polls are now telling us that at least part of their work now is being done remotely. This is relative to the complete opposite pre-COVID, when it was only about 30% that had been working at least part-time in a remote way before COVID-19. And I guess more strategically, I don't want to make equivalents between the Great Recession about 10 years ago and now, because there are a lot of differences. But I think governments did learn something from that situation in terms of labor force and workforce development. As we all know, in 2008, 2009, 2010, governments were shedding a ton of positions, and they really didn't recover from that. The pipeline was decimated in many ways in terms of workforce development over the next 5, 7, 8, 9 years. And they never really recovered from the losses that they took on from a workforce perspective right after the Great Recession. I think they're actually strategically learning from that situation 10 years ago, whereas you're seeing a lot of governments, especially given the effects on public revenues, look for ways to continue to provide services, retain employees, but do so in a way that you don't have a ton of skills, highly skilled individuals being either laid off or let go.
Thanks, Josh. Oscar, can you talk about it from the public health perspective?
There goes to me.
Oscar,
right.
you may be.
Yes.
Okay.
Sorry about that. I thought I had all lined up, and the mute button gets me every time.
Oh, it happens.
So from the public health perspective, it is quite an interesting question, because technically the public health enterprise has been operating as if there is no vaccine from the beginning. And it really points to, I would say, areas of significant challenges that can occur. Specifically, and I kind of use the term resources in kind of 3 stems. We have resource-rich environment, we have resource-deficient or marginalized, and I guess the middle class of that in between. So you're going to find yourself, at least from a public health enterprise, having to deal with that particular spectrum as to what resources are going to be available for you to be able to do your job as effectively as possible, while at the same time trying to administer to the overall public and community needs, if in fact we are in a position where there is the ability for us to transition from identifying areas of hotspots, how to mitigate the impacts of COVID on our lives, if in fact we're going for a sustained period of time without a vaccine, because that has some significant implications both on the present concern as to how to mitigate the virus and its direct disease-related impacts, and all of the secondary and other tertiary components which are non-COVID related but are impacted as such. How do we get access to nutrition, as we mentioned, education, the preventive health mechanisms, the resources that are going to be important to ensure there's safe masking, safe hand hygiene, the physical distancing, efforts, and the communication strategies that are going to be important for not just pushing those messages out, but to ensure that there's community buy-in, whether it's the public-private partnerships or an uptake of that message. And it's more than just putting a billboard up. So I would say that it would be a significant challenge and just a continuation of the work that's presently being afforded, because in the public health spectrum, you will essentially have to, shift your resources in a way that looks for things to be a little bit of a long haul. My last analogy would be one of, we think about things in terms of there's a sprint, which we know this COVID response is not a sprint, and there's a marathon, which we know at some point ends. This is really like the Amazing Race. There are no rules. There's, tons of, there's no cheering fans. You have to make it up as you go along, and you have to adjust accordingly because you have just yourselves and others to get you through to the finish line, wherever the other side of the world that may be.
Wow, what a great analogy to the Amazing Race. And now we all can say we've all been contestants in that show. Jed, let me turn it over to you to kind of talk from a data perspective and just kind of to answer the question as well.
Sure. Thanks for having me today. Thanks to Mathematica and Route 50 for hosting this important conversation. I think from a data perspective, this pandemic has really revealed the importance of governments at the state and across all levels of government using data as tools to be able to figure out what's happening. And that's not just, as Oscar was mentioning, public health data, right? There are many knock-on effects where data is really important to be able to understand the economic, childcare, preparedness. And so if you think about what states are doing, there's obviously a lot of technology problems with data systems. That's not a surprise to everyone. So there is a component here about upgrading systems. There's also a component here about really being able to make the best of the data the government already has. So there's a lot of data the government is gathering that's not being shared in ways that are productive in terms of the response and recovery efforts. And so just as one example, there are places like Ohio that has an Innovate Ohio platform that's brought together data sets from all over the state, hundreds of data sets, and they've really been prepared to take on the pandemic and to understand the impact it's having on their populations. In fact, Alisha, as you know, I published an article in Route 50 last week that talks a lot about this. Specifically, it's called To Address COVID, States Need to Use Data Better. And so there are lots of other examples in there of how state governments are using data as tools to be able to do this work. I just want to highlight one other thing, which is to say it's really important, I think, as we're thinking about how data is being used, to not view data as something that's monolithic. People aren't monolithic. And so there are many things we need to make sure we're accounting for in data when states are using that data, looking at demographic data, ethnicity data, to see what different populations are being affected in different ways. And so that's a really important component of this, I think, shouldn't be forgotten.
Great, thank you for that remark. And in the widget, in the resources widget, the article that you just alluded to is actually in there. So Jill, last but certainly not least, I want to get your thoughts on adaptability and just if there's no vaccine, what does that mean for in an education mindset?
Great, thank you, Alisha. Thank you for the birthday wishes. I have been saying, no, this is really like my perfect birthday. This is exactly how I want to spend the afternoon. So it's a pleasure. So the uncertainty around when we'll return to the new normal, I like Catherine's phrase. That's exactly what I call it too, because we aren't ever going back to the old normal in education. COVID will shift and change that trajectory. So it means we can be in the state of what we might think of as direct impacts, right? As Oscars and others have said, for 18 months or so, but then indirect impacts for several years. I think the main thing we need to be prepared for in education is how disparate and potentially catastrophic COVID will be on existing socioeconomic and racial inequity in education, both services and outcomes. The direct disruptions we're experiencing since last March that we think with or without the vaccine will go to at least next September will disproportionately impact students in Black, Latinx, and communities experiencing poverty because those communities are more severely impacted in terms of health, as we've heard, in terms of job losses, the flip side in terms of being essential workers who have to report to work, who are then both further exposed, but also it makes it difficult to support their children during remote learning. So I'd say the top priority for this year for preparedness is to support families and students and school staff to keep them safe and engaged in learning, right? So those two things, I love everything that we heard about data. We're going to need data from all sectors, the public health sector, the education sector, to keep them safe and engaged, and that's really the crisis we're all pointing to. That's the top priority for this year, but the top priority in the next few years is to plan those set of investments to address the racial and economic inequity that most certainly became worse and possibly a lot worse.
Thanks, Jill. So as you all kind of alluded to, or as you all were talking, I kind of was jotting down some of the characteristics, if you will, of adaptability. Some of the key phrases that really jumped out to me were interconnectedness. I'm paraphrasing this, but based on what Megan said about you're never going back, but just letting go of what was and thinking more towards what will be. Virtual, harmony, continuity of operations, adjustment, data, and investment planning are all really seem to be some of the chief characteristics of how state and local leaders really need to think about when they're thinking about adapting their mindsets and adapting their policies and procedures. So as we use that thought exercise, I obviously we know there will be a vaccine coming in the week and the months ahead, but you know. With that respect, here we are, it's fall. This is the time of year we've been hearing about really since the start of the pandemic about this will be one of the hardest stretches, the fall to winter. And as you all are seeing, cases are already up. Experts are saying the next 6 to 12 weeks could be the hardest that we will face. And in that regard, we're getting ready to kind of see even more hurdles to the state and local enterprise at a time that has been severely stressed. And so basically with that thought in mind, and now thinking about where we are today and where we need to be for the next 6 to 12 weeks, particularly, Jill, I want to kind of pick up on the education standpoint, because I think obviously that's a huge topic right now about schools and learning and what to do with students in this new normal. And obviously everyone is doing this a little bit differently. But as we kind of start to look ahead to what the fall and winter would be, I'm really curious to hear from both you and Megan, just in terms of as governors, mayors, county executives are starting to think through the next few weeks and months, what should they be thinking about? What are they going to be looking at in terms of a continued remote learning, or if they're going to open back up? So what are some of the things that you all would be recommending to these state and local leaders in this juncture that they're about to be in, for how to operate and act and adjust at this point forward? So Jill, you can go first, and then Megan.
Great, thank you. So the good news there are already tools to model ways to organize instruction to make sure schools don't become the source of infection spread. They exist already. Mathematica worked in close partnership with the Pennsylvania Department of Education, who was very close to their state Department of Health. So that right there, that's that partnership we're talking about. I work with other state Department of Education. They're like, oh, health, we don't know what they're doing. They just like hand down edicts and we got to deal with it. So we really want to promote that close collaboration, but we worked with them to apply a model of infection spread that incorporated different scenarios around not only kind of anticipated infections, but it took into account things like school size, class sizes, grouping of students and cohorts that maybe don't mingle, the transportation constraints, feeding students, and what the state felt like were feasible mitigation strategies in their states, like mask wearing and distancing. States are up against different realities there. And the results showed ways that schools could open safely without contributing to the spread of COVID in their communities. And Pennsylvania adopted the hybrid model that came out of that took into account both their structure and what they felt was feasible in their states. And that type of model can be adjusted for any state or district based on their realities. You might get better or worse outcomes based on what you think you can and can't do in terms of mitigation strategies, but it can be adapted. Similarly, you can model when a school should close in-person instruction when infection rates or positivity rates get too high. Right now, if we think about let's take it to the post-secondary level, college and universities, there are several that have successfully returned to in-person instruction. They have almost all relied on frequent testing, sometimes universal testing if they can, and that along with mitigation strategies like mask wearing and distancing have completely shut down the spread at some schools and universities. We've also worked with some on adaptations to that. We worked with the University of UC San Diego, which looks like other universities that are either too large or not wealthy enough to feasibly test all their students all the time, right? So we looked at other public health strategies, one of which included testing the wastewater from their dorms. That can be a very cost-effective way to identify where you might have positive cases and how you might need to effectively quarantine some students. So those tools are available right now. They do evolve constantly as we learn more in the public health space about how the virus spreads, and people are bringing those innovative solutions by bringing together public health, workforce, and education assets. So I'm actually pretty optimistic about our ability to open schools and have them operate in a safe way that at least doesn't further spread the infection.
Great. Megan, what are you seeing in terms of how the states and localities are starting to are working on this challenge, as well as thinking about the next few weeks ahead?
Yeah, absolutely. And I think you nailed it, Alisha, in your intro to this question around one thing that we know, and is always the case when you're looking at 50-state public policy, no two states are doing it the same. And even within states, there's a lot of variance in how districts and schools are handling opening, reopening, closing, and how all of those things are going to happen. Though there are some helpful tools that we're sort of seeing. I know Jill had mentioned in her earlier comments around equity and access to and engagement with the learning environment. So one place we've looked for access data is the U.S. Census Bureau that's been conducting weekly household pulse surveys since mid-April that ask about many things, including access to devices and internet for educational purposes. So when we're looking at some of those equity and access to the learning environment, knowing which students are not able to access the learning environment so that we can target some of those services to those students has been the focus for a lot of states. And states and localities have been very innovative in this space. I know a lot of districts and schools and states are doing this, but a couple of examples. The New York City Department of Education distributed 300,000 internet-enabled iPads to students and used a tiered distribution prioritized by need and handing those out. And South Carolina deployed Wi-Fi through school buses this past spring and enacted legislation in June directing the state to procure monthly hotspot services through December of 2020. So I think in this adaptation phase, states are really trying to figure out where the need for access to the learning environment happens and how best they can meet the needs of the students where they are. And looking forward, and a quick plug for ECS, we are releasing 7 policy outlines next week on the impact of COVID-19 on educational systems, equity implications, policy considerations, and state examples in 6 threads, including governance, transitions, equity, people, outcomes, and finance, to help states think through this tremendous time and how they can sort of adapt in these areas. And one of those outlines is on accountability in school improvement, and provide some policy considerations for states as they move into the new school year and seek to address that gap in data that we saw this past spring and how they might be able to move forward. And one example of that is from North Carolina, where they enacted legislation this year that changes the requirements for calculation of school performance ratings. And indicates that no additional schools or administrative units in need of improvement will be identified based on 2019 and 2020 data, since we have that gap, and ensures that any assistance and intervention that's currently being provided to schools in need of improvement will continue moving forward. And I'm sure that we're going to be seeing a lot more state action as the school year progresses, and we see this need to be, flexible and agile moving forward in the school and learning environment. So we'll be keeping an eye on that as we move forward.
Thanks, Megan. And I liked, I'm going to use that phrase, the adaptation phase that we're find ourselves in. And Oscar, I'm going to bring you in on this, because obviously I started this portion of our conversation talking about where we are from a public health standpoint and where we're about to go. Obviously, we've all been through the initial sort of public health restrictions that we got in the early outset of the pandemic. So I'm curious to hear from you, now that we're in now that we've learned so much more about the virus. What should we start to expect to be seeing in terms of how state and local health departments might be what might they be recommending? What might be different? What might be the same? And kind of how is the data informing those decisions?
Great, thank you for that. And it's a very convoluted answer, but one that I'll do my best to answer within the time frame. So we recognize now at the beginning there was a little bit of data, We recognize that there were issues with the data that's collected, and many folks don't necessarily get that. Oftentimes, data is collected from a granular perspective, meaning it's at the point of who is entering, who's providing the input, and therefore how we can then collect that, aggregate it, and have a sense. And we saw that very rapidly when there was lack of information or lack of complete information on race and ethnicity, which was a critical juncture at this point. Now we've been moving through the flattening the curve phase, as we all remember, and we kind of shot past that one, where now we are focused on what is going to happen in the next few months. Seeing that things are on a rise with respect to disease incidents, and that there's a significant shift in the populations that are being infected. It's a much younger population demographic, akin to the high mobility, and of course some of the movements that have gone back to reference to schools, et cetera. And my colleagues were exactly correct when they say you can do it safely within a school environment, but as we can see, the issues that lie really are underscored by the behavior of our communities and our people. And when I say our people, meaning the community, the humans who make up our society, that's really where we're seeing the most concern with respect to access to data, identifying their behaviors, and figuring out how the messages are going to be very clear to enact change so that we don't continue to see this upward trend that is happening with respect to the transmission of disease. So from the public health standpoint, where things do come into play is also going to be mitigated by the fact, again, to this amazing race analogy, that our people are tired. Our staff, our workforce, they've been depleted. We've seen the impacts of them, folks being fired, being, threatened, being the trust being maligned, and just, reaching this critical phase. So not only do you have concerns around the data infrastructure, the ability to have funds to support and to upgrade the systems that are been antiquated at best, to be interoperable with all of the new technologies and innovations that are being put into play. But you also have to have that investment in the next generation, or the workforce, as we talk about, who needs to be educated to carry on the race. Because unfortunately, we're going to be at a critical juncture where we are seeing a lot more healthcare workers and other individuals that are, falling by the wayside, that are succumbing to the illness, or even themselves to the fatigue, the mental stress, and all of those other key points. So that if you are able to now message out to the community, here's what we know. Here's what needs to occur. And irrespective of whether or not it's a large event, a rally, a wedding, or a small family event, it's still down to the community level of behavior that needs to have significant change if we are going to be successful in the next few months to come.
Great. And, Oscar, the conversation around the workforce is, you were talking about the stress and fatigue that's being faced. Josh, I want to bring you in on this because obviously you do a lot of work on workforce, and obviously it's not just public health. You look across the state and local government workforce. And so I'm curious to hear from you, as I alluded to before earlier. This workforce is stressed. Yes, they've been able to move to a remote setting, but that does not mean that they are still not facing the effects, like all of us are facing the effects of what it means to have been in a pandemic. And now that we're in month 7, and it could be far worse than we have seen to date. In addition, there is still the need, as you alluded to earlier, about continuity of operations. So for state HR professionals, for state managers and leaders, and local managers and leaders, what should they be thinking about, and what should they be kind of stressing with their employees in the near term of the fall and the winter seasons?
Well, I guess a couple things. There's I think a good news story, and there's an opportunity to build on some seeds that have begun to grow. On the good news story, the report that my colleague just put in the group chat, where we asked state and local workers about how they're feeling in this COVID environment, is the work that they're doing for residents and the roles that they're playing has really highlighted the important role that they fill in their communities. And so we're seeing a large portion of state and local workers beginning to identify the important roles they play, the the tangible effects of the work they do day in, day out to help support their community. So there's a good news story there, and I encourage you to look at the report. On the flip side, not on the flip side, but as in terms of areas where we could build on, is if you step back over the past decade and you look at what was going on with these state and local workers, you saw in an effort to provide sustainable benefits to these workers, more costs were being shifted from the public employer to the employee for their retirement plans, for health care, for other costs related to their benefits. At the same time, these employees, even pre-COVID, were more and more stressed regarding financial decisions they're making in their own lives. One area our center has really focused on is how do we help these state and local workers make informed financial decisions? And so we've been really building out our research on financial wellness, specifically geared towards state and local workers. Financial wellness has been the focus of private sector workers. To the extent it has been focused on the public sector, it's typically been for federal workers and military. But one really important role that public employers can do is help their workers around financial wellness, make informed decisions around not just benefits and compensation issues, but issues that they deal with in their own personal lives. Saving for your first home, dealing with student loan payments, developing a budget and dealing with debt. And what we're finding is that if you help these employees make informed decisions, they're less stressed at work, they're less concerned about financial concerns at work, and you have a more productive individual, signing in or coming in to work every day.
Great. Catherine, can I bring you into the conversation? Because I remember the point you made earlier about you don't want to go back. And I think that there's an interesting kind of aspect to this whole not going back, but how can we start, if we're not going to go back, how can we start to do things a little bit different? So obviously from the perspective where your organization looks a lot at the social determinants of health, are there things that we can do right now, especially as we are in a new phase of the pandemic? Are there things that state and local leaders can do differently, and can they start to do better around the social determinants of health in the time that we find ourselves in at this moment?
Absolutely. And I'm going to be really tactical and practical, because I think it's useful when we feel overwhelmed to find things that we can actually act on. And I think it's really important to build on existing programs and policies, and particularly at the local level, you see this all over the place. And I'll give a specific example. In many communities around the country, they are building off of existing complete streets policies, and they are expanding access to the outdoors for millions of residents. And for folks who are not familiar with complete streets, these are policies that ensure that cities are designed to include the needs and safety of residents who use all forms of transportation, including biking, walking, and public transit. It's really about making sure that streets are designed to serve people of all ages and abilities. So what I think is fascinating is that you have many communities that are currently adapting those complete streets programs, and they're creating safe streets, which is where literally I wish I could show you right outside of my door, but my street, where I live, has actually become a pedestrian walkway. The Department of Transportation has set up simple sawhorses where they have made it. They force cars to slow down or not even come on the street so that more people can actually get outside, try to be healthy even when it's a little bit colder, and essentially have access. And here in Baltimore, where I live, the city actually looked at those areas that have less access to parks and green space, and actually started implementing these slow streets programs there, which I think is fascinating. Also, another great example is the city of Minneapolis was actually one of the first major cities in the US to reopen its streets to residents for socially distant physical activity at the beginning of the pandemic. And they purposely selected specific routes and street loops that would connect 21 miles of parkways throughout the cities. So, these are easy, cost-effective ways to really make a difference in people's lives right now. And the more that we can do that, and the more that we can use data to actually help cities choose about where to implement and expand some of these policies and programs, I think the better residents are served.
Catherine, that's great. And that was actually also a perfect tee up to get Jed into the conversation, to the point that the more we can use data. And Jed, you said in your opening remarks that, and as I do know, we did just publish that piece about there are ways for states and cities to use data better. Can you can you go a little bit further with that and start talking about what has been amiss up until this point, and what can cities and states start to rectify right now that puts them in better positions to not only think about how they respond from a public health perspective, but some of the things that Catherine was talking about, as well as how this trickles down to other areas like workforce and education?
Sure. Yeah, I think that's a great question. As all the panelists have mentioned, all this stuff is interconnected, and it's all on the foundation and bedrock of data. And so just zooming out for a second, I think when you think about whether it's transportation officials in a city or public health officials or workforce officials, they're wanting to make the decisions based on what does the data trends in our community look like, right? Obviously, infection rates and things like that are extremely important, and we've seen many states make that information available both to themselves and to those decision makers and to the public. And so just as an example, if you wind the clock back to January, which seems like eons ago, and you look at the state of state addresses the governors gave, only a small handful of them even mention the words data anywhere. And you fast forward to now, every state has a COVID dashboard that's displaying real-time data about the infection rates in their states, often cases the ability to drill down to county or even census tract levels to understand what's going on there. And so that level of data is really a key tool. To your question, one of the keys is how is that data being used? So equipping, making sure that people in, as Joe mentioned, across departments, health departments and educations, understand and know how to use that data is really key. We've been tracking some of these ways that states have been using data at Results for America. We have something called the Invest in What Works State Standard of Excellence. It looks at how the best practices of how states are using the evidence and data for decision making. We did an analysis of those COVID-19 dashboards in this year's edition. So I think that's going to go in the chat and folks can read more about that. But there's some really good examples in places like Minnesota, where they're tracking supplies, spread rates, demographics of people. Massachusetts, as I mentioned, in terms of making that data more useful, has put all that data on their website. So it's open data. People can download it and slice and dice it. And so I think one approach is making that data more usable and how to do it better. And another is making sure that our policies are reflecting that and that we're making decisions based upon that. And so obviously I talked about the infrastructure aspect of it, there's the use aspect of it, and then there's the people including it in their decision making. So I think those are all important facets of how we can be collecting and using data better in ways that are going to make sure we're responding in whatever phase of pandemic that we're in.
So Jen, I'm going to throw this to you, but then also if anyone else wants to respond to this, we did get an audience question that I think alludes to, alludes to something you said in your opening remarks about when you look at the governor's state of the states, not many people were talking about data. And now here we are with COVID dashboards, and we do have states, as you alluded to, that are, I think it was Ohio you mentioned. I know in the piece you wrote with Route 50, we talked about Indiana, and there are states who are now not only leveraging data, but empowering it across sectors. But obviously some of this was because of the pandemic. So the question that we got from our audience member was, from your multi-sector perspective, what can state and local governments do now to sustain data structures or products that were born out of necessity beyond the pandemic?
Yeah, that's really key.
Throw it to everybody else. Go ahead. Sorry.
Yeah, a lot of states and localities really got out their duct tape and their glue, and they decided how they could fit these pieces together. And many of them thought they were doing it for a couple weeks or a couple months. Sure, we can sustain this manual entry on tracking this for a little while. But I think folks have realized that they're in there for the long haul now. They really need to build infrastructure to do that. And so one part of that is around collecting new data. So if you look at the federal, for example, look at the Paycheck Protection Program, right? When we're designing these policies, are we making sure that data is being collected, right? So like on the Paycheck Protection Program, would it have been helpful to know about some of the demographic data or the financial data of people who are receiving that so we could make sure it was having its intended effect? And so part of it is building that in on the front end in terms of the legislation. Another piece is making sure that we're now taking these systems and moving them away from manual entry, figuring out what what is the way we're not tracking this on spreadsheets? How can we use simple technology solutions, which are readily available, to be able to do this and make it much more automated? And then at the much more complicated level, how are we using data scientists and data engineers to connect that work on the back end, using things like data warehouses and data lakes to make sure all this information is being integrated together? And so I think it's a continuum from sort of simple things we can do at, Oscar mentioned at the front lines how this data is being collected, improving that. And then at the back end of sort of the boiled up level at the state and federal level, how we're merging data better. And so I think there's various types of solutions we should be looking at all levels there.
Anyone else want to respond to that question? Oh, Oscar, I hear you. Go ahead.
Josh was about to say something.
Oh, sorry. I'm sorry.
I just wanted to jump in to say, so we work closely with the International City County Management Association, which represents over 10,000 city and county managers from around the country and overseas. And we saw, over the past 5-10 years, there's a lot more interest in, and because of a whole range of issues from historical perspective, oftentimes these city managers and the councils that they reported to were focused on general local government programs and policies, and often it was segmented away from their local health departments. And we've seen over the past decade a lot more interest by many city managers to really work more closely with their local health department counterparts and weaving in health considerations into the range of general local government policies and programs. And so one of the products that came out of this sort of identification of the need for closer collaboration is the City Health Dashboard, which ICMA works with NYU on and others on, where at this point there are 500 cities that have have health data provided for them, but not on at the county level per se, but on the specific jurisdictional level, so that these county managers, these city managers can make decisions about health data related specifically to their jurisdictional lines, which may or may not meet the exact county lines that the data is tailored for. And I would encourage you to go visit it, because there are many cities that are using that data now to make informed decision on a whole range of topics, from transportation to, I know Complete Streets was mentioned earlier, that is a really good model for, as we emerge from this COVID environment, using data that's tailored to the specific jurisdiction that's not necessarily pegged to just the county level or regional level.
So to add to the conversation piece, as an epidemiologist, one of the biggest issues that we have to contend with is that people believe we're data hoarders, that we want all the data to ourselves, data. I love data, but I don't need every bit of data stream that's there. I need the most effective, complete as possible, and efficient collection of data to help me make informed decisions and to provide those analyses to those decision makers and others, whether it's the community members or the elected officials or the authorities, to understand this is what we have, this is the picture for multiple streams to be able to enable us to make solid decisions. So in the course of this outbreak, we ourselves, even as national office, we're receiving all these calls for, we need a dashboard, we need this, we need that. And it became one of not having to having too much. And then we also saw, because of, I would say, the renewed interest in public health, or I should say health, education, and the other, public sector engagements, did you see the private businesses getting into it? I had folks telling me that they're creating things and they're creating these modules, and we're like, well, that has already existed. That existed here, or this group has provided that. So it shows where people are operating in a vacuum, and not necessarily one that shows an interoperable or a form or fashion that is really geared towards a complete overall response. And part of that I blame in respect to how we've handled this particular response, and it hasn't been as coordinated as it should. We haven't really engaged all of our sectors in a way that truly allows us to be part of Team Awesome to accomplish to this end. So one of the things I do want to definitely address that's important to the data element is another underlying concern that is a policy implication is that around legal authority. So I will tell you, as being an epidemiologist, even writing policy statements that impacted the difference between FERPA and HIPAA. Those who don't know, FERPA supersedes HIPAA, and FERPA is predominantly there for the educational department, the educational industry. And you can essentially block access to school health data by virtue of FERPA, even though from a health information from the HIPAA side, you technically should be able to access it. So these nuances, these changes in the legal authority of what you can collect or what you are able to ask for does serve as a challenge into the ability for us to look at the nuanced ways of collecting data and adapting them in a way that maintains the health and safety and security of the community and the residents and the individuals that are providing the information, while at the same time allowing us the latitude to make innovative and community mitigation efforts and strategies that can really help us in the long run.
Thanks, Oscar. Before I move on to our next topic, I just want to check if anyone else wants to chime in. All right, hearing nothing, I'm going to, and Oscar, I think that question about legal authorities, when we get to the last portion of kind of what's the road ahead and the long-term implications, I think we can come back to that and talk about it a little more in depth. But one aspect of the conversation that I know we've alluded to a couple times, but I really want to spend a few moments to drill down on is around equity. This year obviously has, well, first of all, inequities have been a long-standing feature of the state, local, and federal government. But what COVID has highlighted with the disproportional high rates of infection and deaths among Black, Latinx, Indigenous Americans, on top of there also the populations who are suffering from greater unemployment, food and housing insecurity, and then not to mention the summer of protests in the wake of the killings of George Floyd, Breonna Taylor, and the police shooting of Jacob Blake. This has been an intense year around racial injustices and how to move forward. So again, as we are in this moment and in this, we're starting to see that we've got some cities and states who are starting to declare racism a public health declaration, but I'm curious to hear from all of your different perspectives. And Jill, I'm going to start with you on this one. It's just, as we think about equity and how to start changing the tide, how can state and local entities, what should state and local entities be doing? What are some of those meaningful changes, and even maybe some of those low-hanging fruit changes that they need to start making right now that they have the opportunity to make? So Jill, I'll start with you on this one.
Great, thank you. I can think of, well, at least two to three. And I'm sure many of the panelists have ideas. So the first thing is what we need to do right now, need to be collecting right now, is we should be assessing students for the learning that's going on now and in the future. So putting forward that means I think we should assess students this year. That is not a universally popular position, so it could stir up some controversy. Many people feel it's not feasible or fair to test students and maintain the accountability we currently have under SM requirements. But I think for this year especially, we need to separate those two concepts. And this is going back to examples that Megan gave. For waiving accountability requirements that penalize schools for performance in this environment where they don't even have what they need to address the challenges they're being hit with seems right. However, I suggest we still need to do that assessment to understand how much students are learning, right? As Megan had pointed out, we already missed last spring. If we don't do it again this spring, we are flying blind for 2 years. And again, I strongly feel we need to be documenting that acceleration of achievement gaps that could be hurtling forward. So I think that's one thing. They should be out there testing, and we should figure out how to have the will policy-wise to say, that's for figuring out where and who we need to invest in the future. It is not for penalizing or jeopardizing funding or threatening takeovers or anything to schools. I think the second thing we really want to look at now and for the new normal is doing a good job on collecting the thing that we worried about that, again, was always true in an inequitable system, but that's student and family engagement, right? So that student engagement, family engagement is central to student success, and studies that came before the pandemic show how critical it is. Even very blunt measures of student engagement, which is attendance, but certainly more sophisticated measures like how engaged are our students with their teachers and their materials, show that lack of engagement is highly correlated with slower learning for younger students, with dropping out for older students. So it's critical, and we saw this, right? The difficulty in keeping students engaged, certainly in the spring where there wasn't any time to plan, but even now, we should start now taking advantage of what is actually a mountain of data that exists. Whether we can get it consistently is another question, because there is so much remote learning. So even based on the spring, lots of districts and up at the state education agency level started scrambling, looking at, okay, what curricula did we use? Which ones moved to remote learning pretty well? Which had pretty good tools for keeping students engaged? Those curriculum providers, and then certainly this year, to the extent that districts went forward with a planful remote for planful approach to either fully remote or hybrid learning, there are data we can capture on how engaged are students, how much are they showing up, how much are they doing the exercises, how much are they engaged with the class. So I think really taking advantage of the fact that there's a pile of data being generated and using that for our learning and our understanding of student engagement going forward is actually going to be crucial for equity. Last, I just want to kind of reiterate some things that I think Jed and others were pointing to on kind of a national strategy for some information that needs to be consistently reported. And Mathematica working on what should be a pretty simple but powerful tool, bringing together things like information on, well, when did schools close or when did they go to hybrid learning? Let's take that pulse survey, who has access to internet and to electronic devices, and then let's look at racial and economic breakdown of schools. So the pulse survey is available. The racial and economic breakdown of schools completely available through the Common Core data. It was that district information we couldn't get. You had to go scrape websites, and it was buried, and you couldn't even always find the plans. And so no national reporting of even that kind of information that would help you put together a set of data that would show you where your hotspots are, right? Your hotspots, your equity concerns, your where is this probably going very badly and where are we going to need to invest. Just pulling together information that exists but in a systematic way could make a big difference, and is something we should be doing and can be doing right now.
Thanks, Jill. Megan, I want to get your thoughts to see if you're joining Jill in controversy, or if you have other thoughts on what, from an equity standpoint, education leaders need to be working on at this point.
Yeah, absolutely. Thank you for that. Yeah, I mean, I think understanding the data moving forward is going to be really interesting. And I don't know that I'll hop in with an opinion about whether we should assess students or not this year. But certainly that lack of data has an enormous impact when you're talking about equity and knowing around learning loss, and a lot of other aspects of the learning environment, engagement with the learning environment. I think attendance is going to be a big question this year, and will impact the accountability question a lot too. So and thinking about equity and our conversation around data, and I think that's the biggest part, is we need data. We need to know which students are participating in the learning environment, whether that is virtually or in remote learning. And I think that attendance piece has been a real challenge in the virtual environment, is understanding which students are engaging in the environment and which aren't. And that'll have big implications, like I said, moving forward in the assessment and the accountability this spring, and however schools and districts choose to handle that data. So I think having data about our student populations and understanding where those, I think Jill said it, the hotspots are, where those gaps are happening, where those equity gaps are happening, and where students are not engaging with the learning environment in the way that they did in an in-person classroom or prior to the pandemic, will be important. And not just knowing which students are impacted, but how those students are impacted, I think is important. Not all students are having access issues. Not all students are facing some of the same issues. And so it's not a one-size-fits-all approach necessarily. So I think understanding which students are most impacted, how they're impacted, and then finding ways to direct services or supports, or in some way thinking about how to meet those specific needs for those specific students is really part of the conversation that we're having around equity, and will kind of appear in some of our upcoming work around equity. So I think there's like I've kind of mentioned, this equity and access and engagement in the learning environment, from having access to devices and Wi-Fi, which I think states are really looking at, creating those safe environments in schools. I think there's some equity considerations around who's going back to school and who's not, and plans for some of those smooth transitions are all pieces that I think data can really inform. And then I think there is that just jumping off of what Joe was saying, and I won't try to say too much more, but in the accountability piece, I think we're having a lot of conversations around that gap in accountability data from this past spring, and how moving forward and having new accountability data and what that means for equity in the long term, and for which schools are getting additional funding or additional services and supports in the accountability and school improvement conversation. So lots of questions and lots of data that exists, and lots of data that can be synced, and lots of data that can help inform decision makers moving forward.
Excellent. So Catherine, I also want to bring you in on this conversation too. Obviously, for your organization, you do assess how city health outcomes on a set of criteria. So A, can you talk about what you're seeing from an equity standpoint, and when you assess these cities, and B, can you talk about what you think they can be doing better today that can help her to improve those health outcomes?
Yeah, would be happy to. And it's a really fascinating concept when you think of looking at the social determinants of health. How do you really look at where cities fall? And we rate the top 40 cities and award a gold, silver, bronze, or no medal across the presence and the strength of these 9 policies. The nice thing is that you don't have to have all 9 policies on the books to get a gold. You only have to have 5. As somebody mentioned earlier, all states are different, all cities are different. The needs differ, and so we really wanted to make sure that everybody had the opportunity to go for gold in city health. What I think is really fascinating when you think about equity is really drilling down to the basics. So one of our policies is earned sick leave. I talked at the top of the session about how important this is right now. So just to be super clear, earned sick leave are laws that require employers to pay people to take time off for illness or injury for themselves or for a family member. And when you think about an environment in a pandemic where not all members of our society have access, it's a real threat to community health. In fact, 8 in 10 people who earn the lowest wages do not have access to earn sick leave to care for themselves or an immediate family. This is an issue. In addition, when we specifically look at inequities in our society, workers who lack access to earn sick leave are disproportionately from communities of color. So you have 54% of Latinos and 38% of Black workers who would lack access to a single earned sick day. And we're actually now starting to see information and studies come out showing that when workers have access to paid leave, infection rates go down. So when I think about what are those actions that local leaders can take, mandating earned sick leave is a huge, huge act that, not all cities have the ability to do this because they may be preempted at the state level. But if there's an opportunity to do so, or even to improve your earned sick leave policy, that seems to me to be a very basic, very important response right here and right now that could also address inequities within our society.
Wonderful. Oscar, I want to bring you into this conversation too, and just obviously from the public health standpoint, especially again, since we've learned so much and seen different ways in terms of how to help the communities who have been marginalized. I'm curious to hear from you what we may be expecting to see from city and county health departments in the course of the next few weeks and months about how they're going to maybe enhance either guidance or resources to these communities, and what have we learned to stop doing with these communities as it pertains to the pandemic?
So one of the projects that we've been involved with in NACHO and with partnership with our colleagues from the State Association, which calls ASTO and CDC, is to actually focus on about 50 or so jurisdictions who have been addressed in social terms of health equity at that community level that have been successful, and that we can leverage the tools and how successful these communities have been, either from a natural perspective or from an integrated process, to learn how best we can then utilize those particular successes and those best practices to amplify out to all communities. Because what may work within an urban environment, it's definitely going to be different from a rural perspective, and of course from a suburban and other, loosely affiliated to that regard. So what I can say is where we view as a critical condition is what can we really change other than, change from the normal. Let's just make a billboard and get that message out. Let's just make a flyer. Let's just have a community forum. Those avenues are not the way people are digesting information. And those avenues are very, very clearly not the avenues where people are taking that information and either accepting it as fact versus challenging, as we've seen. So we need to be able to adapt our messaging, our communication, our leveraging of course, social media and any other thing else that's enabling those individuals to become ambassadors for the truth. And that's ultimately going to make a difference into how better we have uptake of the messaging and of the change in behavior and what we anticipate that we will see in the upcoming months. Because if we're faced with the marginalized communities who automatically are saying, and these are messages that I hear, well, I don't even want to go to get tested because I don't trust you because of Tuskegee. Well, Tuskegee, I have to go through the information that they didn't test them. They did. They weren't trying to treat them, and that's different than saying we're testing you to find out a disease. And then secondarily, the fact to have a much more diverse, population that's involved in the clinical trials. Once again, the question of health equity and environmental racism and all these other tests that have been done in marginalized communities, that distrust is there. So how do you tell people, listen, we actually need more diverse populations to be active in these clinical trials to rectify all the issues in the past so that we know that the treatment and the diagnostics that are being put forth are encompassing as much of a diverse community as possible so that it's not just geared to a particular segment of the demographic. And that's a difficult message to get over because you still have the hurdles of the mistrust, which is added on top, I'm trying not to make it gloom and doom, but added on top the total destruction, as I would say, in the belief in the public health enterprise. We see our institutions that we have lauded, that we have supported, that we have looked to as the shining, castles on the hill being kind of disintegrated and being told or being shown that they don't necessarily have the voice, that science isn't prevailing. So how do we build upon all of those things while still trying to reconstruct issues that have either been broken down and really try to ensure that that connection point and the pathways and the frameworks that we can use to really connect with people, that it's not just about we have gone to this Sweet 16 party or you went to this rally or you had a family gathering. No, it's not that. It's what are you as an individual recognizing that you are part of the solution, and therefore we need you to be part of Team Awesome if we're going to be successful in all shapes and forms.
So, Oscar, the way I heard you talk about is obviously, build on some of the change that we've learned about in the last 7 months, but then also there's going to be a need to reconstruct. And I think this is a really, really good segue to kind of talk about how we push forward for the long term. What are some of the resources and and policies that state and local leaders need to start pivoting to, because yes, we're in the middle of response right now, but we're not always going to be in the middle of a response. There will come a time when we're going to move to a recovery, and there will come a time when we're going to come to whatever this next normal is. So what I would love to, because we do have enough time, I think I'm going to ask you all to weigh in on this question as we think about the longer term and what we need to take away from the moment that we found ourselves in, and how we build on what we've learned, but then also make sure we don't reconstruct inequities or reconstruct inefficiencies in the system that doesn't serve everyone and definitely doesn't serve them all well. So I'm going to actually, Oscar, we'll just start with you actually, and just kind of think about long term. What do you want to see from the state and local public health enterprise? What do you think needs to be there to set yourselves up for that success?
I'll try a transliteration or some extent of it. Sustainability. Our sustainability is going to be driven on a couple things, and I'll just focus on the letter S. So S of sustainability means that when we're thinking about the workforce and the staff and the trainings and all of the other pieces that we're now throwing monies at, when we look at the CARES Act dollars, that in actuality, and I'll be very frank, most of those dollars have not made it down to the local level. They're been stuck in kind of administrative processes and other particular elements, or, states are trying to bank them to use for other, kind of funded opportunities. And we're not seeing a dissemination in a way that's going to really show this investment in the people and the investment in the processes and the infrastructure and the policies to be successful. So sustainability is not just throwing money against a disease, but at a system that is typically focused on the entire building, on the entire restructuring, reframing, thinking again how we even fund local jurisdictions and state jurisdictions. The paternalistic approach may not necessarily be the answer in all cases. Just look at the federal response. So, technically, in some sense, you may have to say, we may have to look at direct funding processes where you fund local governments directly versus giving money to the state and hope that it gets filtered down. That top-down approach may not be as successful as folks believe. And then the other component is resiliency. Building these models within that same connection of the S that allows us to say we can withstand these particular hits on our system, that we know that while there's this big push to get contact tracers, that there's a period of time when we're not going to need contact tracers, but those are the same individuals that we want to be able to deal with the chronic disease conditions, the patient navigators, working on the diabetes, the heart disease, the cancers. These are all, and the infectious diseases, these are all things that are not just tied to one particular disease. So as you develop our systems and rebuild our foundation, rebuild those trusts, it is that taking it out of our comfort zone, maybe taking services out into other facets of the community that people may have that better development of trust, and to be able to execute things in a more efficient manner than our brick and mortar approach.
Excellent. Josh, I want to get you into this conversation and kind of talk about from a workforce perspective is how we start to build on change and then also do it in a way that still is servicing across a very vast landscape of state and local workers, but particularly at a time when we don't know what the state and local workforce is going to look like given budget cuts and potential furloughing and contraction of government employees.
Yes. So I think what the past 6-8 months has really taught us is, we need to have the expertise within localities and local health departments and general local governments to help make informed decisions for meeting the needs of residents, especially in regards to COVID. And I'd like to really highlight a line of research we were doing probably the past 2 or 3 years that I think really could be built on going forward. Especially in rural settings that were having localities were having a hard time recruiting and retaining those with skill sets in terms of epidemiology or public health nurses or health inspectors. And we found that there were some very innovative localities. We've done case studies in New Jersey, in Minnesota, in Iowa, in Massachusetts where localities, either counties or towns or townships, were sharing public health experts across jurisdictional boundaries. And so whereas you may have a county in rural Iowa that might not be able to afford a full-time epidemiologist on an ongoing basis, sharing it amongst multiple counties to be able to provide that service to their residents, we saw as a very innovative staffing model, and that one that theoretically could be built out going forward, especially to deal with a lot of like the topics of inequity that we've talked about before during this call, not just regarding COVID, but regarding a whole host of other aspects of local services. And so that's one aspect that we don't advocate for anything, but at least we'd like to see maybe explored more to see if you could share expertise across jurisdictional boundaries a little bit more effectively.
Great, excellent. Catherine, going to bring you into this.
It was interesting. I was sitting here just reflecting on the fact that because we're all being forced to be hyper local right now, we can only travel so far away. I travel from my dining room to my bedroom, which is my office. We're all just really intensely connected at this point right now to our local communities. And it really makes me wonder, how that might change behavior after a vaccine becomes widely available, and also how that changes how we engage in civic life. And so a couple of things that I hope come out of this are that, in my nerdy, wonky heart, I really hope that social determinants of health loses its jargony moniker, and that we embrace the idea of being really intentional about major issues that I think we all deeply understand have an effect on health outcomes. So how are we going to think about homelessness? I'm really thinking about the revenue hits that states and localities are facing right now, for many different reasons, including some inaction at the federal level, and what that means for local communities and what that means for individuals who are living within community. I also think as we reflect on what is going on both in the West and in California in terms of the fires, how are we thinking about climate? And how are we thinking about sustainability? Oscar, I'm going to pick up on your S, and resiliency beyond just a pandemic response or reaction. I'm also hoping that we're starting to really grapple with what systemic racism looks like, how we can address it through policy and other ways. And I really do think there's a real opportunity for local leaders to do that. It's a daunting challenge. I by no means mean to say that this is an easy checklist, but it seems essential in order for us to really have communities in which all people are able to flourish and thrive, not just survive.
Yeah, Catherine, I'm really struck by, and just as a reminder to our audience, we do still have a little bit of time for questions, so if you want to go ahead and submit, please do so. Catherine, I'm struck by what you just said about, obviously right now we are so hyper-local, but as you kind of alluded to with climate, that is not something that can just live within one locality. That's something that has to be a massive, not only just a city, county, state, federal effort. And Jen, I want to bring you in on this because I think this has a really interesting tie into data and a little bit on the legal authorities we were talking about earlier, is that obviously states have built their own dashboards, but for other things that transcend borders, how can they in the future be thinking about setting up data in a way that's not just specific to just their community or their state, but also something that is beneficial across jurisdictions and kind of helps in this national effort of data collection?
Yeah, I think that's a great question. And I think we've heard a lot of different themes from folks around how we can do that. I think it all starts with being intentional about being intentional of what we want our policies to achieve, whether it's Catherine talking about earned sick leave or social determinants of health, or Oscar talking about sustainability. I think we really need to be intentional about what we're trying to achieve here, and then making sure that we're gathering data to measure out where we're meeting those goals. And we're making that data publicly available in ways that everyone can understand at a national level. What does this look like in terms of what we're trying to get at and how are we achieving it, making that transparent, publicly available for people to understand. And then knowing what the equity implications of that are, knowing that it's not going to affect everyone in the same way, and understanding that we need to target more specific programs to be able to address those inequalities that we're seeing, and being intentional about the way we're doing that. But taking back to your larger question of how do we build infrastructures across the country to be able to do this, I think the federal government has a real opportunity as a national spender through things like the CARES Act, but also in the everyday spending it does through giving formula funds out to cities and states for education, for urban development, for homelessness, to think about how it's using evidence-based approaches and encouraging people to use evidence-based approaches. And so, we have a whole wealth of information out there about what we know what works, things that are being evaluated, been shown to be more effective. So how are we making sure that states, localities are using those approaches? Just as one example of that, my colleagues at Results for America have produced something called Ed Research for Recovery, in partnership with the Annenberg Institute at Brown, which looks at what does the education research show us about the situation that schools are facing with the pandemic, and what can they do now? And so it has top flight education researchers that are looking at this and writing briefs on things like how to engage students that are disengaged, how to deal with English language learners, how to deal with people that are transitioning to secondary education. These are all ways we can use evidence-based approaches. And so when I think about a larger national approach, it's about figuring out what our goals are, thinking about how we can measure those, and thinking about how we can implement those in ways that are evidence-based that are really going to improve outcomes, and how we're tracking those outcomes and continually improving in places where we're not finding that we're getting the results.
Thanks, Jed. So I want to make sure, just to round this up, that I also get to Jill and Megan to talk about, from an education standpoint, about what should we be, how can we build on the massive changes that we're seeing to the education system, but also start to reconstruct it in a way that, obviously, I think, Megan, you alluded to the COVID slide, so there are going to be some real implications here for education. So curious to hear from both of you. Megan, I'll start with you, then go to Jill, on what is the nature of change that you think state and local leaders really need to explore for not just this school year, but for like 2, 3, 4, 5 school years down the line.
Yeah, absolutely. Thank you. I think, without getting into recommendations, but really thinking about where there are some opportunities to address the pandemic in ways that could benefit schools and students long term, but also are really things that policymakers are thinking about short term, and thinking about where the data exists, or where the research exists to say where some best practices might lie. So I see this in really all the way across the education spectrum, but I'll touch on 2 pieces where I think state policymakers, we're seeing a lot of energy around these conversations, and where there's some research pointing to some best practices. And the first is in student health and wellness, really trying to tie it back to some of our public health conversations. We know that trauma and stress have significant impacts on children and adults, and 2020 has certainly provided plenty of that. And schools are really going to have to address that. We also know that upwards of 2/3 of children who receive public health or mental health care do so in a school-based setting. So thinking about access to health professionals and health services in schools will be an important consideration in the immediate and the long term for schools and districts and states. And states have been finding opportunities already to include this moving forward, and really thinking about it long term, but also within the context of reopening schools and reentering school buildings. An ECS analysis of state reopening guidance and plans found that at least 43 states have prioritized student mental health and social emotional wellness in their reopening guidance for districts and schools. So I think we're seeing a lot of energy there to really say this has had, everything that's happened in 2020 has had a significant impact on our students, and we need to understand what those impacts are, and then figure out how we can address those as we reopen schools and move into the new school year. And of course, all of those things are going to have tremendous impacts in the long term. And the second piece is learning loss. I've mentioned it several times already today, and others have alluded to it. The disruptions to public education from COVID-19 are unprecedented, really. But policymakers can look to some prior educational research to understand how best to support students in recovering from potential learning loss. And there's sort of three strategies that we've seen come out of that. The first is intensive tutoring, and I think we've seen some states really looking at that. The second is increased instructional time, including extended school days and extended school years. And the third is prioritizing learning acceleration and avoiding over-remediation moving into the new year. So instead of trying to backfill information or hold students back because they might have missed something this past spring, really thinking about how we can get students caught up in the new year while continuing forward. And I think those are strategies we've seen in the past through other natural disasters or other moments where smaller numbers of schools have had to close and where some energy might be interesting. And we're seeing states do an enormous amount. I think we're tracking about 600 bills related to COVID and education specifically in our online tracker. And so we're going to continue to see that move forward as legislatures come back in January.
Thanks, Megan. Jill, I definitely want to give you the opportunity to respond, but also we've got about 5 minutes. So I want you, as you respond to the question I posed, I also want you to kind of tell us, because we got an audience question about, for all of you really, about what you're optimistic to see. So Jill, if you want to kick us off on that front, go right ahead.
Yes. So I'll combine what we're hearing, that we're definitely, we have a bottom up and a top down. Things have to happen at the state and local and the national level. So, and I don't have any issue wading into recommendations. So again, this for what we're all saying, the fear we've had, the concern we have about whatever learning loss, exacerbating inequities, all of that, it could be profound. We're just sitting, that's the fear in my heart about how bad this has become. So that needs to assess, to document that is critical. And that has to happen at the local level. I also think this conversation around, but there is evidence out there. Lots of entities support evidence. You've heard lots of good examples. Even nationally, there are entities that support evidence. The What-Works Clearinghouse, the regional educational labs work to disseminate evidence. And many of those entities have pivoted to try to help states and districts specifically with best practices around online learning, remote learning, how to keep students engaged. So I think really at the local level, taking that evidence and implementing it as best practice is useful. At the same time, though, when I say I want us to document because I want us to know where we need to target our resources, the degree to which we have to target resources might be pretty intractable for some districts. So the notion that we need a national strategy too. So do we just want to spend more on education, or do we want to triple Title I funding? Because that's a policy on the table for one presidential candidate, right? So it's that kind of question, right? The needs that we're going to have to overcome what has happened during this time period probably can't just be solved at the state and local level. So I think that's critical, that we're going to have to make some very, very challenging decisions around not just using more resources to support education, but how we're going to target that. That said, I find optimism in all those things. I find optimism in all this innovation. Everybody has referred to what's happened at the local levels, how people scrambled, how they came together. I find optimism in the amount of data that is generating that can be used to make decisions. I really think it's just a matter of harnessing and supporting all that data so that we can turn it into something that can be used, but people have given lots of examples how that happened. And then I think it is the local, national, community, really political will to get in there and target those resources the way they're going to need to be targeted after we've documented what has actually happened here.
Thanks, Jill. So we have only a few minutes left, so I'm going to ask all of you to quickly tell me what you're optimistic for. So Megan, I'll ask you, what are you optimistic about for the future?
You know, I think we're thinking about things and students in different ways because of this pandemic. So I think the focus on student mental health and wellness and social emotional wellness has me pretty optimistic about how we're looking about supporting students moving forward.
Excellent. Josh, what are you optimistic about?
Well, we've been doing a research series on workforce of the future, developing the workforce of the future. And when you look at a lot of these examples of jurisdictions that get it right, they do a very nice job of telling the story of public service and the important role they play. I think that this current COVID-19 situation and the recovery really is highlighting the important role that states and localities play, and those that work for states and localities fill for the residents. And so I think that there's a lot to be proud of, and there's a lot for governments to hang their hat on as far as the important role you feel if you come into the public service. And so I'm optimistic about a larger segment of the population considering a career in public service going forward.
Awesome. Catherine.
I'm really optimistic about young people. I think young people are holding all of us accountable to truly make change. They're holding our feet to the fire, which I think is fabulous. And they are also keeping our eyes on the prize in terms of what are the real challenges that we have in front of us. And they refuse to let us off the hook. I think it's great.
Excellent. Jed, tell us what you're optimistic about.
I'm optimistic that when eventually the pandemic does come to an end, which it seems like it never will, we will remember the feeling we all have now about how important data, evidence, facts are in tracking and understanding what we're doing and making sure we're getting the results that we want.
And Oscar, last but certainly not least, tell us what you are optimistic about.
That no matter how much or how dark it seems, I use the phrase, the dark night of the soul, no matter how dark it may seem, that what I look forward to is that there's a cadre of professionals who get up every morning, whether they are health directors, nurses, epidemiologists, administrative assistants, restaurant inspectors, whatever you name it. They get up because they have this altruistic viewpoint that this is their life's work and that we have been training all our lives for this moment. So that's what I look forward for, both not only my faith in those individuals and their own resiliency and their own vigor and rigor in this particular process, no matter how bad they've been beaten up on and how unsung of the heroes that they are, but that we would see others rise to the occasion to support them and to be just like them and making that their life's work as well to continue our defense against disease and illness in our population.
Well, I can't think of a better way to end this session but by hearing all the optimism that you all just shared. So first, let me thank all 6 of you for your amazing comments, your amazing thoughts, and most importantly, your time. Obviously, there's so much going on in the world right now. There's so many things that we all have to deal with. So I really do appreciate you taking the time to talk to me and inform our audience of what can work and what can state and local leaders do to push past this very dark time. So again, thank you for joining us, and thank you to our audience for joining us, and I want to thank Mathematica for the opportunity to partner for this wonderful event. With that, we're signing off. Have a great day.